In 2013, I stood here and I wanted you off sugar. And in 2014, there were 4 of us speaking, and this year there are 8. And so we are all part of this change in how we need to look at what we eat for our health. It's so important, and I think it's actually our choice when we have the right information as to what you want to do going forward. So would you like to choose a healthy life? Well, yes, wouldn't you? It's pretty obvious. But I think the answer lies largely in our nutrition, but also in how we approach life. And if you have the right information, you can start to make those decisions for yourself. Because there's only one person who has that control, that choice, and that's you. So I'm okay with smokers now. 25 years ago, I wouldn't operate on smokers, but I'm actually okay if you want to smoke nowadays. I'm okay because there's so much information out there about what effect it's going to have on you, that if you've made an informed decision to do that, and you're happy to bear the consequences, then I'm actually okay. But with nutrition, there's so much confusion, and I'm actually part of it. I openly admit to creating confusion in the last few years. So today I'm going to try and sort out some of that confusion, and hopefully the other speakers are going to help me along the way. So if you've been raised on the food pyramid, I think you're going to die by that food pyramid. And along the way, you're going to take up that shape as well. We're going to look at how processed food has actually affected our health and how cutting out processed food is actually probably going to improve it. And along the way, we're going to actually try and define what processed food is. That's part of the confusion out there. Here's an idea. Do you ever hear the medical profession encouraging children with a nut allergy to have peanuts? No way. Have your peanuts and then have your adrenaline. I mean, it's the dumbest idea. You just wouldn't do it. If you're allergic to nuts, they will kill you. So today we're going to look at diabetes. What happens in diabetes? Well, diabetes is known for having high levels of glucose in the bloodstream. And if it's too high for too long, it will kill you. Just like those peanuts will do, but slower. More like cigarettes. We know they're bad, and over a long period of time, the cumulative effect will probably knock you off. So the glucose, we know, comes from the sugar and carbohydrate we eat. And if you're diabetic and you eat too much glucose, it ends up in the bloodstream, and then we need to take more medication to reduce it. So why are our current guidelines in diabetes telling us to have all this carbohydrate, 50-60% of our diet, and then telling us to have medication to bring it down? It's the dumbest thing in medicine. And yet it's propagated over and over. So Diane and Penny today will help us look at diabetes from that aspect, from that preventative role. We'll hear of the amazing results that we're getting here and what they're getting in South Australia on lowering that carbohydrate intake. Now, lifestyle clearly plays a role as well. So we're going to hear from Katie, Jess, Paul and Carly today on how there are other issues with our health beyond nutrition, yet they all tie in together. But unfortunately, I do have some bad news for you all today. We're all still going to die. Low carb will not stop you from dying. The question is, do you want to die old or do you want to die sick? And that can be our choice, and that's where I'll begin. Here it is. This is my take on processed food. Sugar will make you hungry. Refined carbohydrate will make you fat, and polyunsaturated oils will make you inflamed and sick. And just like fireworks, in the wrong amounts and the wrong combination, they're highly inflammatory. And each by their own might be all right, but if you have too much and too frequently, they end up as one big inflammatory mass. So today I'm not going to try and convince you that I'm right, but I am going to try and convince you that what you've done in the past might be entirely wrong. and start researching for yourself, because that's what I did some years ago now, and that's why I stand before you today trying to let you know that there is a choice. So why, as an orthopaedic surgeon, speaking up about nutrition? It's because I'm at the coalface of those issues that we see us in modern society. I call it lifestyle-related disease. I did a clinic yesterday at the hospital. It's exhausting seeing patient after patient who have actually got preventative problems. They're completely and utterly avoidable, but over decades we've created them for ourselves. Obesity is destroying our joints. I'm the first surgeon in Australia to refuse to operate on patients who are too heavy with joint replacement. I've done that for some years. I've had to justify it before my professional colleagues. But rather than telling people to go away and lose weight, I'm trying to help by giving them a real tool to actually do something about it. Diabetes in northern Tasmania is out of control. And I'm the surgeon having to put up or look after the foot complications of that population. Now, I used to do that every few months. Now I'm doing it every week. I saw 3 new patients yesterday. 3. Now, I wouldn't have seen those going back 10 years in 3 months. Our health costs are out of control. It is not sustainable for our society, and it's certainly not sustainable for us. And we're all here today looking for an answer for that. As a result of all of those observations and my research, I came up with this nutritional model of inflammation. It's the combination and the amount of sugar, refined carbohydrates and polyunsaturated oils that I think is toxic. So if we're going to have a model, and we're going to work through this, we need to make some observations, and there's a hypothesis, talk through the mechanism of and what the association evidence is for it, and whether or not we've actually got some proof that it works. So we got to the top of the food chain over 2.5 million years by eating in one way, and we've now been on a convenient fad diet for the last 50 years. What I'm talking about is not a fad. This is the way we used to eat. What we've been doing to ourselves for the last 50 years, and particularly the last 30 years, is the fad one. We're getting fatter and sicker than ever. We've got an increasing rate of obesity, we've got an increasing rate of cancer, arthritis and gout are increasing. There's been a doubling of gout in the last 10 years, and I'll come back to where that comes in with sugar in a little while. Increasing autoimmune diseases. We're going to hear from Carly later on how that shift work and nutrition can actually fit into that whole model. There are increasing mental health issues, the spectrum right through from autism to depression to dementia, right through life. On and on and on. Everything in medicine, medical disease, is actually increasing. That's what I call modern disease. Medicine, unfortunately, focuses on the disease rather than the cause. And doctors, on the whole, just treat the problems with more and more medication. And I think we can do better than that. I think at the moment we're all like lemmings about to go over the cliff. We are doomed unless we get back to the preventative medicine. The other observation is that if you look at all disease, underneath them all is inflammation. It sits behind everything: diabetes, cardiovascular disease, dementia, cancer, over and over. It's just inflammation. So if we can look at the cause of that inflammation, we might be able to do something about modern disease and turn it around. So onto the hypothesis. Here it is. If we can find the cause of the inflammation, we can find that toxic material, we might be onto something. And to me, that toxic material is processed food. That combination of sugar, refined carbohydrate and polyunsaturated oils. And that, once you've created inflammation, renders the body susceptible to further injury. It doesn't cause it, but it renders it susceptible. Other factors then clearly come in and have a secondary effect. They include stress, based around our cortisol levels, our genetic makeup. They include chemicals. And our gut biotome, our gut flora, is proving to be a major influence on health. Exercise plays a role. Where we live can be a major determinant of health. We've got a much higher rate of MS, multiple sclerosis, in Tasmania than you have when you get closer to the tropics. Latitude plays a role in disease. Sleep clearly plays a role, and I openly admit to not having enough. So I'm setting myself up there. Vitamin D is so important in the metabolism of sugar and fructose, and I'll come back to that. Even artificial lighting is implicated in our health and related to melatonin levels. So we've got a hypothesis, but how does it happen? How do those pieces of the jigsaw fit together? So let's look at sugar. Sugar is half glucose and half fructose. They're very, very similar, but they're shaped differently, and as a result of that, they're metabolised completely differently. Now, we know a lot about glucose metabolism. Glucose is absorbed from the gut, goes straight to the brain, and under the influence of insulin, it will be distributed into the muscle and the liver. But whatever we can't utilise right there and then is stored as fat. At any point in time in your bloodstream, if you've got a normal blood glucose, there's about 4 grams of glucose in your blood. That's about 1 teaspoon of sugar, of glucose. Any intake above 1 teaspoon of glucose gets converted to fat under the direct influence of insulin. That's what it does. So if you have 1 slice of bread, it has 5 teaspoons of glucose in it. 1 is metabolised around the bloodstream and the other 4 get straight into fat. That humble little spud, I'm talking about, this size has about 6 teaspoons of glucose in it. 1 metabolised, other 5 to fat. I've got a saying that if you eat enough potatoes, you'll ultimately look like a potato. Here's that bowl of rice. 15 to 20 teaspoons of glucose, 1 metabolised, 14 to fat. Same with a bowl of pasta. Hidden. We didn't know about that. I didn't know about it until a few years ago. So the other half of sugar is fructose. And the metabolism of fructose was only described pretty well in 2010. So any guideline that was written before 2010, in fact most of them have been written since, completely ignore the fact that we didn't know about the metabolism of fructose. And it therefore puts our guidelines out of date. So the sources of fructose are seasonal fruit, as distinct from manufactured fruit, sugar in any form, honey, and high fructose corn syrup. They're all the same fructose molecule. Doesn't matter where it comes from, that's where it is, it's just fructose in there. So fructose has got a complex metabolism, but I'm going to try and simplify it down. That big round blob up there is a liver cell, and if we put fructose into it, it's going to come out with a few different products. The first thing is we get the production of glycogen. Glycogen is that immediate energy source that we use in the body if we're going off into panic and we're sprinting away from somewhere. There's not a lot of it that's converted into glycogen, but there is some. Now we know that if you want to make alcohol, you use grapes. The liver does exactly the same thing. There's a thing called an aldehyde pathway, and if you put fructose into it, then in fact you get converted into alcohol. And if you have too much alcohol in your liver, you end up with damage to it. Fructose is broken down into a thing called uric acid. Uric acid is this substance which is associated with gout, and most people have heard of gout, and it's a highly inflammatory material. The trouble is that uric acid is quite toxic to our body, and particularly the substance called nitric oxide. I'm going to explain what nitric oxide does and what role it plays. There are 3 forms of nitric oxide. There's a neuronal one which controls the blood supply to our brain. There's an endothelial one which actually controls the tone in our blood vessels. It allows us to regulate our blood pressure. And there's a third one called the inducible form, which allows our white cells to move around the body and manage infection and our immunity and cancer. So if we introduce uric acid into the equation, it inhibits the effect of nitric oxide. It decreases the blood supply to our brain. It's implicated in the cause of dementia and mental health. When we do that same thing to our blood vessels, we lose the vasodilatory effect and we end up with hypertension. And some of you will have come off sugar and found out you're coming off your high blood pressure medications. And that happens within days. If you do it to our white cells, we decrease their function and you end up with poorer immunity, higher infection rates, and it's clearly implicated in long-term infection and cancers. Fructose actually acts as a leptin inhibitor. Now, leptin's a hormone produced by the fat in our bodies, and we've got plenty of fat on board. Leptin will be circulated around the body and tell us we're no longer hungry. And it's a great mechanism. So if you've got plenty of stores, you don't need to keep going out and sourcing it. Fructose will inhibit that effect. It will make you hungry. Fructose, the byproducts of it will also stimulate a hormone called ghrelin. That's the one which makes your tummy rumble. So when you've got ghrelin on board, your tummy's rumbling, the leptin's been inhibited, you feel hungry. And it's a wonderful thing, fructose, when you're trying to actually deliberately put on weight to get ready for winter hibernation. It will deliberately make you hungry and it will drive behaviour. And that's what I've come to recognise in this whole topic. The food actually drives behaviour far more than we've been told. But here's the important pathway for today's discussion. It's called de novo lipogenesis. If you take fructose in, it gets converted into the small dense LDL particles. These are the lipoproteins that move fat and protein around through the bloodstream. And the small dense LDL ones are the ones we're going to hear more from Ken Sakaris a bit later. But they're also the ones which are implicated in cardiovascular disease. And if we increase our fructose load, we end up with more of these small dense LDL particles. Those LDLs, as I said before, are made up of fat, protein, phosphate and cholesterol. But the cholesterol is not the problem, it's the fat in them. And what we eat as fat is reflected then in those LDL particles. It can either be a saturated fat, like butters, or it can be a polyunsaturated oil that we see in the seed oils. And the difference between fat and an oil is what state it is at room temperature. A fat is solid at room temperature and oil is liquid. And that state of liquidity is actually dependent on double bonds within the oil, which allow flexibility, allow it to become liquid, but each double bond within that oil is in fact a point of weakness, it's a point of oxidation, and that's critical because when a fat becomes oxidised, it then becomes inflamed. So saturated fats have got no double bonds in them, no points of weakness, nothing to oxidise, nothing to become inflamed, and they're as flammable as a brick wall. But if we fill up on polyunsaturated oils, all those double bonds are points of weakness, points of oxidation. That's just like rust. That oxidation releases oxygen-free radicals and they're damaging to the system. And that's inflammatory. Those small dense LDLs end up in our blood vessel walls. They move around the bloodstream, and I call them a Goldilocks particle because they're Goldilocks because they're just the right size or just the wrong size to get into the blood vessel wall. When they sneak into that blood vessel wall, that's the point where they become oxidised, and that's inflammation. Now the body then tries to get rid of that inflammation by these white cells, these macrophages. And the beautiful thing about these macrophages, they're under the direct influence of vitamin D. Vitamin D makes the macrophages, makes the white cells clear out the inflammation. Vitamin D is normally available at the end during summer, isn't it? When's fruit normally available? End of summer, beginning of autumn. So when we are meant to be eating fruit and sugar, Mother Nature gives us the one thing we need to actually clear up the inflammation, called vitamin D. So why do we eat sugar all year round when we only have a decent amount of it in summer? So back to our cells. Our cell membranes that hold everything in is mostly made up of fat. And that purple imagery up there, that wall, can either be filled up with a saturated fat or a polyunsaturated oil. The same thing goes with our mitochondria. The mitochondria are little engines within our cells. They're the powerhouse where we convert our fuel into energy. And its membranes contain fat as well. And again, we can fill them up with a saturated fat or a polyunsaturated inflammatory oil. So the trouble is, if we're now filling up our blood vessels and our cells with polyunsaturated oils, all those double bonds are highly inflammatory, and they're all producing a mass of oxygen-free radicals, and that's inflammation. That inflammation is in every blood vessel, in every organ of the body. It's inflammation in every cell membrane, and it's in every mitochondrial membrane, and I'll come back to that part later in my cancer talk. So let's turn our attention back to carbohydrate. Carbohydrates are glucose in all of their forms, whether or not you're coming at it as a starch, as a bread, rice, pasta, lactose, dextrose. And then there's fructose, which is off to the side. So half of sugar we know gets converted to glucose and the other half to fructose, but ultimately that gets into these small dense LDLs, the bad cholesterol. A little known fact about glucose is that we will in fact convert 3% of it back to fructose. It's called the endogenous conversion of glucose to fructose. That's called the polyol pathway. 3% of glucose gets converted to fructose. Now that probably isn't a big problem. But along the way, when you do that conversion, we again release more oxygen-free radicals. That's an inflammatory pathway. If you have too much carbohydrate, a bit more inflammation. The 1984 paper changed everything for me last year. If you are obese, or if your blood glucose gets above 7, which happens if you're pre-diabetic or diabetic, happens regularly, you don't convert 3% of glucose to fructose, you convert 30%. So 30% of the carbohydrate you take in is then converted back into fructose. What does that mean? We've just increased our fructose load upon the body a whole nother layer. And in it, another massive increase in our small dense LDL production. That means even more oxygen-free radicals. I think that's our runaway train of modern disease. More inflammation than we've ever seen before. That's the mechanism. So have I got any association evidence to back all that up? Again, let's look at sugar, refined carbs, and polyunsaturated oils. In the 1970s, we started increasing our fructose consumption dramatically. That means we're producing more LDL particles. In the 1970s, we also saw a significant increase in our carbohydrate intake. And via that polyol pathway, that means more small dense LDLs being produced. We're starting to flood the system. But again, in the 1970s, we did this with our polyunsaturated oil component. That big vertical line is what we'd started doing. We introduced seed oils, vegetable oils into our diet, processed food, takeaway food, a massive increase. That equals oxidation in every one of those LDL particles and also in every one of our cells. Have I got any proof for that statement? This graph shows the amount of inflammatory omega-6 polyunsaturated oils in our fat. Linoleic acid. Stephan Guyenet's put this data together dating back to 1960. So in 1960, about 8% of the fat in our bodies was inflammatory fat, omega-6, 8%. Over the last 50 years, it's steadily increased, and now we're up to 24%. And I've heard someone quote 30%, but we've had a 300% increase in the amount of polyunsaturated inflammatory fat in our fat in the last 50 years. The same thing has happened with women's breast milk. A dramatic rise in the inflammatory omega-6 component of women's breast milk in the last 60 years. The omega-3 down the bottom stayed the same. And that is a reflection of what we eat, nothing else. And that's what we're feeding our babies. Well, not me. What does that mean? Well, that equals inflammation in every blood vessel, in every cell, and in every organ of the body. Oxygen-free radicals are released all over the place. I think that's toxic. Welcome to modern disease. So what intervention evidence do I have? Well, low carbohydrate diets, very topical at the moment. They are effective in decreasing weight and keeping it off. I have over 25 studies showing the effectiveness of a low carbohydrate diet beating a low fat diet. More importantly, it's actually sustainable. Not for everyone, nothing's sustainable for everyone, but it's certainly sustainable with 12-month results, even one at 2 years, at about 80% sustainability. I'm sustainable, I've been doing it for some years now. So we also know that low carbohydrate diets work in diabetics. And Penny will present a little bit later the CSIRO results related to that and their latest research on that, and we thank it for coming across. Low carbohydrate diets have better results than low fat in dropping triglycerides and raising good HDL numbers. So they actually do improve cardiac risk numbers. Professor Ken Sakaris will take us through that a little bit later. Very low carbohydrate ketogenic diets are definitely being used in epilepsy, diabetes and cancer, and effectively. Now, there were some blue zone longevity cultures described in 2009 where people live long, die old, low rates of cancer. And their common factor is not what they eat, because they've been looked at to say, well, what's the secret? What do you eat to try and actually live long? The common factor about them is not what they eat, it's what they don't eat. And what they don't eat is sugar, refined carbohydrates, polyunsaturated oils, processed food. And they have a strong spiritual community, and that plays a role. They have low stress. It seems to work. Maybe that's the answer. So I think we do have a nutritional model of modern disease. I do think that processed modern food is actually toxic. And that combination is inflammatory, and it affects us in every organ of the body. It makes every part of the body susceptible to those other factors we covered before. But I think they're secondary to our nutrition. I think our convenient modern food is a weapon of mass destruction. I do think inflammation sits behind every condition. And if we look at the cause of that inflammation, then we have a model to prevent virtually all modern disease. The cause of that inflammation is processed food. And I think it's time we start putting out the inflammation. So what's the answer? The choice for all of us is in eating real food. And for me, that food should be fresh. We should be eating by the seasons. We should be sourcing our food locally with minimal food miles. And that just ends up being low in sugar and refined carbohydrates. That just means increasing our healthy fats from nuts, cheese, and well-sourced meat and fish. It means getting rid of those highly processed polyunsaturated seed oils. And that ends up being LCHF, lower carbohydrate and healthy fat living. It's got a label, but all we're describing is actually eating food which is local, seasonal, and most importantly, fresh. So here's my take on processed food again. Sugar will make you hungry. Refined carbohydrates will make you fat, and polyunsaturated oils will make you inflamed and sick. So, would you like to choose a healthy life? Well, yes, should be your answer. Thank you.